In the vast and diverse continent of Africa, amidst its rich cultures and stunning landscapes, lurk some of the most frightening diseases known to mankind. These unseen predators, often hidden within the very air we breathe or the water we drink, have plagued humanity for centuries. Join me if you dare, as we explore the top 5 most terrifying diseases haunting the continent of Africa. Our journey begins with a silent predator, a virus so deadly that it can bring a grown man to his knees in a matter of days. Ebola, a name synonymous with fear and suffering, first emerged from the depths of the rainforest, announcing its presence with brutal efficiency. The 2014 West Africa Ebola outbreak, the deadliest on record, painted a grim picture of this virus's potential for devastation. Entire villages were decimated as the disease spread like wildfire, fueled by fear and a lack of understanding. Scientists, armed with knowledge and driven by determination, worked tirelessly to develop vaccines and treatments, striving to ensure that the horrors of the past are not repeated. From the rainforest, we emerge into a world grappling with a different kind of epidemic, a silent killer that has woven itself into the very fabric of humanity. HIV/AIDS, a disease that targets the body's immune system, leaving it vulnerable to a host of opportunistic infections, has left an indelible mark on the world, particularly in Africa. The virus, transmitted through bodily fluids, spreads silently, often undetected until it has already taken hold. Antiretroviral drugs, once a distant dream, are now a reality for many, offering a lifeline to those who once had none. Through education, prevention, and treatment, we are slowly turning the tide against this global pandemic. As darkness descends across the African plains, a tiny terror takes flight, its buzzing a harbinger of misery. Malaria, a disease that has plagued humanity for millennia, continues to cast a long shadow over Africa. For young children, the elderly, and those with weakened immune systems, malaria can be a death sentence. Simple interventions, such as insecticide-treated mosquito nets, can drastically reduce the number of malaria cases. Scientists around the world are working tirelessly to develop new and innovative ways to combat malaria, from more effective drugs to vaccines that could one day eradicate the disease altogether. Our journey takes us now from the humid swamps and plains to the crowded streets and slums, where another invisible enemy lurks in the shadows. Tuberculosis, an airborne infectious disease that primarily attacks the lungs, has plagued humanity for centuries. Tuberculosis, spread through the air when an infected person coughs or sneezes, can lie dormant in the body for years, only to re-emerge with a vengeance. Tuberculosis is curable with a combination of antibiotics taken over several months. Efforts to combat tuberculosis are underway worldwide, with a focus on developing new drugs to combat drug-resistant strains of the disease and vaccines to prevent infection in the first place. Our final destination takes us deep into the heart of Africa, to a place where a fly's bite can have devastating consequences. Sleeping sickness, a parasitic disease spread by the bite of the tsetse fly, is a silent thief of minds, slowly robbing its victims of their health and sanity. As the disease progresses, the parasite crosses the blood-brain barrier, invading the central nervous system. Efforts to control the spread of sleeping sickness focus on controlling the tsetse fly population through trapping and spraying insecticides. Research is also underway to develop new and more effective drugs to treat the disease. These diseases, though daunting, highlight the resilience and ongoing efforts towards medical advancements in Africa. Despite the challenges, scientists, healthcare workers, and communities are working tirelessly to combat these deadly diseases. The fight against these diseases is a global one, requiring collaboration, innovation, and unwavering commitment.